Hello, everyone, and thank you for tuning in to see to learn more about the COVID vaccine. Afterwards, we'll be doing a Q&A where you can ask specific questions about how it may affect you and your sarcoidosis. My name is Andrina Johnson. I am the director of the upcoming documentary Project Purple Mission Sarcoidosis Awareness. And with me is Miss Amy Cobb, who is a nurse practitioner, also living with sarcoidosis. And she is the one with all the information that will be sharing it with you tonight. Please say hello, Amy, and introduce yourself. Tell us more about you.
Hello, Amy Cobb. Oh, I've got an echo. Do you have an echo on your end or no?
I don't hear an echo.
Okay, good. I think it dropped. I'm a family practice nurse practitioner, but this talk tonight is independent of my employer. I'm also an advocate for Foundation of Sarcoidosis for sarcoidosis research, but this talk is also independent of that. I'm just doing this as a service to my fellow Sarc warriors and the general population who might have questions about the COVID-19 vaccine.
Hello, Audrey, Haley, and Carol.
I think Andrina and I were going to ask you to try to hold questions. Do you want to give a little bit of the format?
Yeah, okay. So everyone's saying hello. Thank you for joining us. Hi, everyone. So Amy's going to tell us everything that she knows. And if you have any questions after that, we have some from the UK. I was wondering. Okay. So after she tells us her information, and we go over some of the questions that were asked prior to today, then we'll open it up for the Q&A. So, Amy, go ahead and enlighten us.
So I'll have about 4 pages of notes, and I'm going to try not to bore you with too many medical details, and I'm going to try not to use too much medical jargon. I'm going to try to speak to the general population who would not have healthcare background. So the first question I wanted to answer is, how does the vaccine work? So any vaccine we've ever had from our childhood, MMR and Tdap and all the things we take as children, on up to what our elderly population takes with pneumonia vaccine, shingles vaccine. How does the vaccine work? And a vaccine works by developing immunity by giving us some version of a virus or bacteria so that our body can build antibodies to that virus or bacteria. That's how the vaccine works. A lot of people have already asked me what is in, we'll just use Pfizer's vaccine for this question. Well, what is in the vaccine? Are there a ton of chemicals? Are there heavy metals? Are there, you know, all these preservatives? And so Pfizer actually released their ingredient list. And so I'm just going to run down the list. The only active ingredient in Pfizer's vaccine is 30 micrograms of a messenger RNA version of SARS-CoV-2. It's not actual virus. It's not actual COVID virus in the vaccine. What they did is they tried to replicate it. So viruses demonstrate a viral spike. And so they were trying to replicate that same spike that SARS-CoV-2.
So Pfizer's vaccine does not have...
It's not a virus, and nor is Moderna's. And those are the two that... Pfizer's has already been approved. Moderna will come and be approved next. But neither of those are live viruses in the vaccine. They're messenger RNA vaccines. So the other ingredients are lipids like fats, salts, and sugars. And I found an article on USA Today where a hospitalist physician said that's pretty much what's in most medications that we take anyway, because you have to have something to kind of bind the medication or the virus together. So it's basically standard packaging, no heavy metals, nothing crazy in Pfizer's vaccine. I have not seen the ingredient list for Moderna's vaccine, but I think it's going to be very similar. So that's what I wanted to go over first. They basically take a weakened down version of SARS-CoV-2, so COVID-19, and they replicate that spike, which is what I was just talking about. And then when it is injected into our body, our immune system starts to work and develop antibodies to the virus replication, not the live virus, it's the live virus, but the replicated virus, it starts to develop antibodies to that. So that if we were then exposed to someone who had COVID-19, we should have a 94 to a 95% chance of being protected if we take both doses of the vaccine. And I'm going to get to all that when I get to the clinical trials. So that's the basics on vaccines, how they work. Basically, you get something injected, your body responds, your immune system responds, we build antibodies to it, and it starts giving us immunity. So that's the basics of how a vaccine works. Clinical trials. Most people have never participated in a clinical trial, so a lot of people don't understand how they work. But both Moderna's and Pfizer's clinical trials were double blind. And what that means is, of the people that were enrolled, which Pfizer had, let's see, over 43,000 participants, and Moderna had 30,000. So you're looking at 73,000 participants between the two trials. Of the people who were enrolled, everybody got 2 shots. You know, they got dose 1, 3 to 4 weeks later, they got dose 2. But in a double-blind trial, neither the participant nor the researcher knows who got placebo and who got the real vaccine. The reason that's so important is if you tell me that I'm drinking COVID-19 in this cup, then all of a sudden I'm going to feel real bad, because mentally we start immediately having symptoms. That's just part of human nature. So it's important to not know, you know, which, did I get the COVID vaccine? Did I get the placebo? So if I have, you know, if people report headache or aches, you know, the scientist doesn't know, but down the line, the drug company knows which one got the real. So that's what fleshes out the truth in the data. If, you know, that's the easiest way I can explain it, so that you know that people aren't just saying, oh, well, I want this vaccine to come to market, so even if I felt terrible, I'm not going to report it. You know, so it's the only way to get true data. Let's see. And then the next thing I was going to go over is the actual trials. So we'll talk about the Pfizer trial first. So the Pfizer trial was proven to be 95% effective against COVID-19 beginning 28 days after the first dose. So what they did is they had 43,000 people in the trial. So half of them got the vaccine, half of them got the placebo. So half of 43,000 is 21,500. So of those 43,000, only 170 people actually got COVID. And that's about your risk of getting COVID in the general population. So it proved true that you're not going to be at any increased risk of getting COVID. In fact, you cannot get COVID from Pfizer or Moderna's vaccine because they're not live vaccines. But it held true that that's about the general risk of the general population. Now, of the 170 people out of 43,000 that got COVID over the trial, only 8 got the vaccine. 162 had placebo. So that's how they were able to come up with their number of being 95% effective. So I want to say that again to make sure everybody understands. 43,000 people were in the trial. Half got the vaccine, half got placebo. So 21.5, 21.5, if you're just guesstimating on that. Of all 43,000, only 170 got COVID over the trial period, because that's your risk of getting COVID just working and going to school and living your life right now anyway. And of the 170, 162 were in the placebo arm, and only 8 people who got the vaccine out of 21,500 got COVID. So that's how they can say that 95% effective. And I did watch a video on YouTube by Vanderbilt Vaccine Center, Dr. William Schaffner, and he said there were no serious side effects or deaths in the Pfizer and the Moderna trials, and there was similar efficacy, like the 95% range, to the smallpox and polio vaccines. Now, how many people in 2020 have smallpox or polio? I mean, we pretty much have eradicated those diseases through vaccine. So that gives me tremendous hope for the future. Moderna's trial. Oh, let me go to vaccine response, because another big question is, what are the side effects of the vaccine? Well, we in medicine are trying to call them vaccine response instead of side effects, because it is a sign that your body is responding to the vaccine when you experience certain symptoms. The data in the Pfizer trial showed that there were no serious responses, only 2% chance of fatigue, 3.8% chance of headache. And then, anecdotally, they've also reported some low-grade fevers, chills, achiness, kind of like flu-like symptoms. And the training I received through my employer, which again, this talk is separate from my employer, but the training I received, they told us most participants who received the vaccine in the trial said it was a little bit worse than a flu shot, but not as bad as a shingle shot. So you feel kind of achy and run down for about a day or so, but then you kind of feel back to normal. So I don't think those are bad response. I'm going to use vaccine response instead of side effects. I think that's pretty well tolerated. And for those of us with sarcoid, we feel that way every day anyway. So we probably wouldn't feel any differently.
I wouldn't even recognize it.
For the Moderna trial, there were 30,000 people in that. And their efficacy rate is 94.1 compared to Pfizer, which is 95%. And there were 185 placebo out of the 30,000 that got COVID, but only 11 who got the vaccine that got COVID during their trial. So very similar to Pfizer's data. Moderna said over 7,000 of their 30,000 were over 65, and over 5,000 were under 65, but had other health conditions. Because I know one of the questions, because I looked at the questions in the chat group before I came on, is, can us with autoimmune disease get the vaccine? And at least in Moderna's trial, over 5,000 had diseases putting them at higher risk of severe COVID-19. And then people have also asked about ethnic and racial disparities. I know both Moderna and Pfizer included all ethnicities and races. They both really, really tried to recruit so that they could have a good sample size for the general population. And I know Moderna published that there were over 11,000 people from their 30,000 that were from communities of color. So I thought that was really good data as well. Now, one of the questions I've received in general is, well, Amy, I take a flu shot and I still get the flu. So why would I take a COVID shot if I'm still going to get COVID? And so just to give you a comparison, the flu shot efficacy is like 23 to 40% effective. Whereas COVID, you're looking at 94 to 95% effective. So I think you're looking at apples and oranges when you want to compare like flu vaccine efficacy and COVID vaccine efficacy. I mean, those of us in healthcare are very excited that the trials look so good.
I do want to ask where you're getting your information from.
So Pfizer's website is where I got theirs. And then for the Moderna data, I got it, I can't remember if it was CDC. I tried to put everywhere I got my data. I think it was on a vaccine journal page online, but it was very similar to what I was presented in my training group. I just didn't have access to their slides. I tried to take pictures when I was doing, because ours was a PowerPoint that I did for my place of work. But it was very similar data, but you can go on Pfizer's website when we finish. Anybody can, and they're published. I actually just cut and paste what they've got published about their vaccine because theirs has been released. I'm sure Moderna doesn't want to release theirs until it's been approved. So trust me, I would not give data that I had not looked up and verified. So, and I'm only using trustworthy sources. That is a good lead in to our top 10 questions, which I think you're going to ask me. Almost every answer I have on these top 10 questions is from the CDC.
Okay, so our top 10 questions. The first one is, who will get the vaccine first? Okay,
so according to the CDC, healthcare workers and long-term care residents will have first access to the vaccine. Now, ACIP, which is the Advisory Committee on Immunization Practices, they were meeting today to give the next rollout. So we have heard that it will be over 65 or people with chronic conditions or immunocompromised, but I have also heard that it might be essential workers, police, firemen, grocery, teachers, transportation, because one big arm of getting all of this vaccine is getting it where it needs to be and getting it there safely. I did see on the news this morning that UPS is going to be shipping most of the East Coast vaccine. FedEx is going to be shipping most of the West Coast vaccine. So we have to have all of those people working for all of our transportation companies up and running and not sick with COVID. So they may be, I have heard that transportation and education, we need our teachers too, maybe in that second wave, even ahead of the 65 and up and immunocompromised, but that has not yet been released. The only thing that we know for sure is healthcare workers, which is obvious because we're fighting it every day, and long-term care residents because they've been hit the hardest.
Well, I'm a substitute teacher. Now I want one. So our second question, will I need another COVID shot next year or every year?
We don't know. And that's from the CDC. You know, this is all new, so we don't know. So we don't know if it's going to be like an annual flu shot or if you'll get it and you don't ever need another one or you need one in 2 or 3 years. We don't know.
All right. I hope not. What is the long-term data?
We do not have it because obviously it was just released. And even though they studied 43,000 people with Pfizer, we didn't know until the UK started giving it that people with severe allergic reactions were going to have the reaction that they did. So if you've seen that on the news, some people who have severe allergic reactions, i.e., that meaning they carry an EpiPen with them, like they have anaphylaxis, their throat might close to certain whatever they're allergic to. Pfizer has now sent out a safety warning for those patients not to take it yet, and maybe not to take it, you know, because that happens when any drug is released. I can give you an example of a drug, but I don't want to get in trouble with any drug companies, but a drug has been released in my career and the drug rep said, oh, it's a clean drug, no side effects. And all of us are like, there's no such thing. And in post-trial data, we did see some side effects. So that happens with anything that's new. That's not unexpected.
Do I need the vaccine if I had COVID?
We think so, but we're not sure. The CDC, as of today, says they cannot yet comment because what happens when you get COVID is I can run a blood test. Several of you have probably heard about the antibody test. So what the antibody test for COVID is, it's IgG and IgM. Most places are just doing IgG, which is like, I've had it, but it's kind of out of my system kind of thing. So before you've had COVID, your IgG and your IgM should both be negative. If you get COVID in a couple weeks, your IgM will raise its little positive. It'll say, oh, yep, I'm here. That's kind of a new, means I'm newly infected. And within 6 to 8 weeks, your IgG will also be positive, and this one may go down to negative because you're in the recovery phase. We don't know how long IgG stays present with actual COVID infection. So I know I have had, I think, 68 patients in my practice test positive since March. And so far, the ones I've tested their blood work, that IgG is still there. But a year from now, 2 years from now, their antibodies might be out of their system unless they have a vaccine. So we think that they will also need a vaccine, but we're not sure.
Okay. How long do the, you didn't like the word side effects, would you call them the
vaccine response?
The vaccine responses last?
So in the training I received, they said, 24, 48 hours. So they were recommending those of us in healthcare maybe get our vaccine on a Friday. So if we are off on the weekend, we can kind of chill if we feel kind of flu-like. But the CDC website, as of today, said they could linger up to a week.
Who is more immune? Someone who has COVID or someone who has the vaccine?
So also from the CDC website, as of today, both natural immunity, which means I had COVID. Like I got sick, I had COVID, I had the nasopharyngeal swab and or the antibody test. Something proved that I had COVID. I didn't just say I had it, I have proof that I had COVID. So that's natural immunity. CDC says natural immunity and vaccine-induced immunity are important aspects of COVID-19 that experts are trying to learn more about, and the CDC will keep the public informed as new evidence becomes available. So who is more immune, we don't know yet.
This one you kind of answered earlier, but we'll do it again. Is the virus live?
So Pfizer's and Moderna's are not live. And you're going to ask me in a few minutes about maybe some other vaccines. But Pfizer's and Moderna's, which will be Pfizer's has been approved. Moderna, we think, will be next to be approved. They are not live vaccines. They are messenger RNA, mRNA vaccines.
So why do I need 2 doses?
So from the CDC website, as of today, the first shot primes the immune system, helping it recognize the virus. The second shot strengthens the immune response.
Okay. And how many COVID vaccines are there?
This is also from the CDC as of November 24th. Large-scale phase 3 clinical trials are in progress or being planned for 5 COVID vaccines.
Oh, wow.
And it didn't really say if that counted Moderna and Pfizer, and there were 3 others. I've heard AstraZeneca has one. I'm not sure who else has one.
So, and number 10, will I still need to wear a mask if I receive a COVID vaccine? Good question.
Yes.
No one wanted to hear that, Amy.
So it's 95% effective with Pfizer, 94% with Moderna, but there's still that 5 or 6% chance that you're not going to be protected. And this is what the CDC said. Be transparent with your patients, because I looked at the healthcare provider information. Be transparent with your patients that the vaccine is not a perfect fix. Patients will still need to practice other precautions like wearing a mask, social distancing, hand washing, and other hygiene measures until public health officials say otherwise. But you guys, think about polio and smallpox. Those have virtually been eradicated, and they have similar efficacy to these vaccines. So depending on how many people get vaccinated, I think we'll be able to get out of our masks sooner.
All right. Well, that was our top 10 questions. Are we going to go over some more information before opening up the Q&A?
Since some people actually posted and submitted questions.
Yeah.
I want to address those because I thank you for those of you who actually submitted questions prior to tonight. So Doris Reynolds asked a question about vaccine safety with her lungs being compromised. And I'm going to tell you to defer to your pulmonologist. I also have pulmonary sarcoidosis, so I do want the vaccine. I'll be in the first wave who can get it since I'm a healthcare worker, but I'm going to ask my rheumatologist and my pulmonologist before I take it. Several patients asked about if you're on immunocompromised, if you're on immunosuppression, prednisone, methotrexate, Imuran, whatever you might be on. And Dr. Patel did a live webinar Thursday night. She is in cahoots or works with the Foundation for Sarcoidosis Research. She recommends, even on immunosuppression, that you take the COVID-19 vaccine. I do think you need to ask your own rheumatologist, but that's what she recommends. She said she wants all of her sarcoid patients to receive the vaccine when they have access to it. Several people asked, were there Sarc or autoimmune patients in the trials? I don't know on Pfizer. Dr. Patel, who was, who did the talk for FSR, she was going to try to find out on Pfizer. But remember, I said in Moderna's trial, I think it was over 5,000 were under age 65, but had diseases putting them at a higher risk of severe COVID-19. Were those diseases, were any of those 5,000 sarcoid or autoimmune? I'm not sure. But if I get my vaccine, I'll get on here and tell you all about it. Allison Wilcox asked, what wave can we get it as sarcoid patients? And I put on there, first wave, we know it's been confirmed, healthcare workers and long-term residents. Second wave is either going to be over 65, the people with chronic conditions, or like I was talking about, essential workers, the policemen, firemen, teachers, transportation. We've got to keep the country running also, and we've got to get the vaccine distributed safely. So I hope that answers your question, Allison. The general population will be the last to get it. And then Keith Falzone, I think, asked how immune will I be, or how protected will I be after my COVID vaccine? And hopefully I answered that. If you take both doses, not just one, but both doses of the Pfizer or Moderna vaccines, you'll have 94 to 95% immunity, which is really, really good. And then Felice Bunkley, I believe, is a transplant patient and a Sarc patient. I would definitely ask your transplant team. I know a lot of my transplant patients get all the vaccines, like their team wants them to get all the vaccines. So I think that's what your transplant team would say, but I would definitely, if you were my patient, I would have you ask your transplant team.
All righty, so that was all the questions prior to going live this evening. So now we're going to open up the Q&A. So now's the time to type your questions and we'll ask Amy.
I see a couple. This is what I think, because not everybody wants the vaccine. Patients who take a flu shot will probably take a COVID shot, but I could be wrong. I feel like my patients who don't take a flu shot probably won't take a COVID shot. So I feel like we need to fight about it. Just educate yourself, know what the vaccine could or could not do for or against you, and then make your own decision. I don't think it's going to be mandated. I know my employer stated we will not be mandated to take it. So I think it's going to be a very personal decision.
All right. So Lisa Beaver says, I have, how you say it, vasculitis, and I'm not sure if it's safe for me. What are your thoughts on that?
So vasculitis, falls in the same category in a way as sarcoidosis. It's usually more severe though. So I would again ask your rheumatologist, because vasculitis is a serious condition.
Okay, and we had a question, will the vaccine exacerbate sarcoidosis if it's in remission?
Okay, so I'm going to pull out my notes. So Dr. Patel is a rheumatologist, and I can't remember where she practices, but she did the talk for FSR. So what she wrote, somebody asked, are Sarc patients at an increased risk of getting COVID? So just because I have sarcoid, am I not, so this is not vaccine related, but am I at an increased risk of getting COVID? And she said, probably only if you have active disease or are on immunosuppression. So if you have Sarc that's in remission, your chances of getting COVID, in her opinion, are the same as the general population. So I think the question was, like, if I'm in remission, should I take the vaccine? Again, you'll have to make that decision for yourself. But she doesn't think you're at an increased risk of getting COVID, put it that way. Like those of us, like I am on immunosuppression. So I am at an increased risk of getting COVID.
Have you heard about people getting vaccines and then it causing a sarcoid flare?
I know my rheumatologist and pulmonologist made me get everything. So I was pretty much in healthcare. I was already up to date on everything except pneumonia. Mm-hmm. I'm in my 40s, so I'm like, we don't give pneumonia vaccine to people in their 40s, but my pulmonologist had me take both pneumonia vaccines to protect me against pneumonia. So I don't know that, and I don't think it caused a flare. I mean, I was so sick at the time. It was in the beginning of my journey, and I have not reached remission yet, and I'm 4 years into my journey.
I know the same thing with me. They want me to get the pneumonia vaccinations, but I just haven't done it yet. But it seems like they encourage it. But Audrey seems to be sensitive to the vaccine, so I would probably recommend that she talks to her doctors about that.
And just, you know, I take a flu shot every year because I am mandated to do that. And it doesn't really, like I said, I feel like I have the flu every day anyway. I think a lot of us with autoimmune disease do. So I can't really tell that when I take my flu shot, and I'm 4 years into my autoimmune disease. So I can't really tell.
Excellent question. Donna Lee asked, were there any pregnant women that were in the trial?
That has been asked, and I think no, not knowingly pregnant, but perhaps there could have been somebody who got pregnant during because the trials are about 4 months, I believe, in. But I will tell you, I've had 2 of my own patients who were pregnant who developed COVID. So I mean, you're not just immune to COVID if you're pregnant. So it's I know on the news, if you're pregnant, you know, talk to your doctor. But I mean, what was scary for the 2 patients of mine who were pregnant and developed COVID? It was very scary for them.
Let's see. What about the kids? Do they know about kids getting it yet?
So Pfizer studied down to age 12, but their recommendations are for 16 and up. And when I said there are 5 vaccines like in the pipeline, I think one of those does have a pediatric arm in it, but I don't know the details. And I'm trying to look at the chat, y'all, but there's so many in there. So
yeah, a lot of people are just sharing stuff.
Does the vaccine cause Bell's palsy, Ruth? Again, Pfizer, and you can go on Pfizer's website, and it's like no serious side effects. I'm trying to find that in my notes. No deaths. Oh, I know. Dr. Schaffner has a 19-minute Q&A on the coronavirus vaccine, and he's from the Vanderbilt Vaccine Center. He said no serious side effects or deaths in the trials. And Bell's palsy is not fun. So I would call that a serious side effect. All the vaccine responses that I have read about were just like flu-like symptoms, headache, fatigue, fevers, not even any GI symptoms.
Do you know how many strains of COVID it will cover?
The only active ingredient in Pfizer's vaccine, and again, this is from Pfizer's website, is a 30 microgram, which is teeny tiny, dose of the messenger RNA encoded viral spike of SARS-CoV-2. So again, it doesn't have COVID in it, but it's got the messenger, the mRNA encoded viral spike. It's supposed to tell your body this is COVID and your body develops immunity to it. Does IVIG affect the vaccine response? I do not know. That's a good question. And again, several people don't want to get the vaccine. If you don't want it, I think there's going to be a huge demand for it. So if you don't want it, let the people who want it get it. And I think it's just something we don't need to fight about, if that makes sense.
Yeah.
Like, decision, and there's no judgment. You do what's best for you.
So a lot of people are asking the question again about having sarcoidosis. What are the risks?
So Dr. Patel, I'll go back to that. And again, she's with FSR. You know, she's associated with FSR, and I think you can find her webinar somewhere. If I find it, I can put a link to it, maybe on this page. But she went over that you cannot get COVID. Like, she kept saying, you cannot get COVID from these vaccines. You cannot get COVID from these vaccines. And she was talking about Moderna and Pfizer. She said she advises all her sarcoid patients to take the first vaccine they have access to, unless they have severe food allergies or other severe allergies and carry an EpiPen, like we discussed. She said, even if my patients are on prednisone, methotrexate, Inuran, Plaquenil, any of the immunosuppressants, she wants them to take the COVID vaccine. So I'm passing that on to her, but we'll say it, and hopefully.
And I want to say something, Lisa. She's not saying that the virus itself isn't live. It's the vaccine doesn't have the live virus. Yeah, we recognize that the virus is deadly and killing people. It's the vaccine that doesn't have the virus in it.
Have a live
virus, yeah.
It's not a live virus vaccine, is what I'm trying to communicate.
Yeah, we're not saying that the virus isn't deadly.
It's very real, very real. I work in healthcare; it's very real. Also, if you are hesitant to take it, healthcare workers are going to be in the first wave. There are 23 million healthcare workers in America. So you're going to have a whole lot of people get it before you have access to it. So that should ease some of your concerns.
Do you have a brand recommendation for people living with sarcoidosis, rather the Moderna or the Pfizer?
Her recommendation was whichever one you have access to. She said whichever one you can get your hands on first. That was her recommendation. And I'm not a rheumatologist, so I'm not recommending whether you take it or don't take it. I'm just trying to give some facts about the 2 trials for the 2 vaccines that are coming out first.
So I guess everybody is, there's no way to know because the virus is new, the vaccine is new. But I think a lot of people are just terrified that what if 5 years from now, something terrible happens to our already weakened, immune systems and bodies. So is there anything in the research that
we don't have the data, but I can tell you, I've had patients with COVID as early as March, who some of my patients still have lasting side effects from COVID. We're not talking about the vaccine. I'm talking about COVID.
Mm-hmm.
So some of those things we've got to personally weigh out. Do I want to take my chance of getting COVID, or do I want to take my chance of a possible effect from the vaccine? You know, if I worked from home and didn't work in healthcare and my risks for developing COVID were really low, I might not be as eager to take the vaccine. But I have 3 kids. I'm out in the community. You know, I try to be as safe and mask and do all the things. But we all want to resume normal life. I know we all want to. We all want to take a vacation again. We all want to go to the movies again. We all want to go to a concert again. So herd immunity is something that has been brought up. You know, how many people will it take to get vaccinated or have COVID until we have herd immunity? And they say 60 to 70% of the population, but the CDC did not really comment. They kind of did not want to take the cure on the herd immunity.
So Deborah asked, will people get the vaccine? People who get the vaccine, will they be told which pharmaceutical company their vaccine is coming from?
Probably, Deborah, only if you ask. Yes. And I do see some comments about like drug companies and all that. I am in my kitchen, like not getting paid by anyone. I promise you. I'm just
yeah. Amy is also going to be starring on our documentary. And, you know, she's really passionate about, you know, sarcoidosis awareness and, you know, medical research and stuff. So she's just volunteering this service. I'm not paying her. She's not getting paid. This is just a free service that she's doing for us in the community.
Dr. Schaffner from Vanderbilt made a good point, because he's gotten a lot of questions about, well, the drug companies just want to make money, blah, 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 blah. The ACIP, which is the American Committee on Immunization Practices, they do not work for the government and they do not work for the drug company. They are external, like they're just an independent group that's not getting paid by anybody to, you know, approve or decline a vaccine. They're looking at our safety. And yes, Aaron, it is hard being a registered nurse and having sarcoid. It's hard being a nurse practitioner and having sarcoid, I would agree.
So we'll give you a last chance to type your questions in. My husband and I both have sarcoidosis. Is this extremely rare, sarcoidosis?
Well, it's a rare disease. They say 200,000 of us in the country. I do want to make a little plug. I have not met this gentleman yet, but there is a Sarc Fighter podcast that a TV anchor out of Virginia started, and it's really good. And he has different guests on that just tell their sarcoid journey. So if you listen to podcasts at all, that's really cool. And then Andrina's making a movie that to help with. So I don't know if you want to talk about the documentary.
Yes. So we are in the production phase of our documentary. We are going to be super busy. Hopefully we can get this vaccine so we can travel everywhere and not be afraid. But if you appreciate what we're doing and you would like to support us, please go to our GoFundMe page and contribute any amount. If you donate $10, your name actually gets included in the final credits of the film. There's different amounts. If you read the whole breakdown, 25 and up, you can get an invite to the virtual private screening of the documentary. Thank you all for joining in tonight. I know this is like kind of a controversial topic with the whole COVID thing. The
podcast is Sarc Fighter, and it's free. Yes. Also, there was one that I saw about, and the sugar additives, Jennifer, it's like 6 milligrams of sucrose. I don't think it would do anything to your blood sugar. And again, that's on Pfizer's website. They actually publish their ingredients. There was something up above the podcast question that was a good question, and I don't know if I can scroll.
I know, I was trying to do that too, and I couldn't do it.
So children have not been studied. Children when the vaccine have not been studied under age 12, or they're studying them now possibly. But I doubt there was a child with sarcoid in Pfizer's trial that was 12 and up. So I would stay tuned on that. Will you have to get the vaccine every year? We don't know. So I answered that at the beginning, and there should be a replay of this, Andrina, for those who tuned in.
Yeah,
late.
it'll be this whole video will be available on our page, so you can watch it from the beginning if you're just now tuning in.
And Charlotte Marshall, it's William Schaffner, which when I watched it, I was like, did they say William Shatner? Schaffner, and he has like a 19-minute question and answer video. It's on YouTube. I watched it today just to make sure I wasn't missing anything. And thank you for all the thank yous.
Yeah.
People and give information. Again, I don't think we should fight about it. You either want it or you don't. Or you don't, or your doctor recommends it or they don't. It's not, I'm not here to try to get people to take it. I'm just trying to give information.
All right. So thank you guys.
One last thing. I think Deborah asked, and I don't know if I answered, will you know which vaccine you're taking? Yeah. So that it has to be stored at the super low temperature you've probably seen on the news. So I don't think you're going to know, Deborah Snell, unless you ask whoever's giving it to you. I don't think they're going to have both vaccines and you have a choice, because I don't think we're going to have that much vaccine.
So what's a cytokine storm? I don't know.
So my rheumatologist told me that his sarcoid and autoimmune patients have actually, the ones that have gotten COVID have done a little better than we all expected. And Dr. Patel kind of echoed that, because we already have a cytokine storm. So our immune system is already kind of overdrive. So we don't do that like the general population has gone into that cytokine storm with COVID, and they've never done it before. We've already done it. Our body's already used to it. So he said he thinks that's why his autoimmune population that has contracted COVID has done better than expected.
Oh, wow. Really? Mm-hmm. Interesting. Mm-hmm. All right. Well, I'm going to let you go, Amy. Thank you so much for doing that for us this evening. And then Patricia has one last comment. Just like the flu shot, it should say what they gave you. Okay, well, that was more of a comment. But yeah, so like she said, the ingredients were listed for Pfizer's because they're approved. And probably when Moderna gets approved, we'll be able to look at all the ingredients then. So thank you all. You've been amazing and such a great turnout. And stay tuned. Like I said, if you would like to show your support for what we're doing, please go to our GoFundMe link in the description, or you can go to sarcoidawarenessfilm.info. Every dollar is appreciated. And thank you so much for your support. And thank you, Amy.
Thank you.
Have a good night.
You too.
Bye.